This is a medical clinic, right? And this is a medical show, right? Where do you send a sick ship? To the dock! Welcome back. We're back from our hiatus.
Yep.
That's a medical term, isn't it? Or sounds like it could be.
Little R&R.
Our sabbatical.
Yep.
R&R. Our New Year's flings. Where did you go on your sabbatical?
Home.
I went and down to Dauphin Island, and it was
That's
beautiful. Cool. And to those of you who suffered at Dauphin Island with our presence, I thank you for putting up with us. It was lovely. And
did you bring any hermit crabs back?
Gee, I hope not.
You'll find out as you unpack.
Hermit crabs, and I was more worried about packing cockroaches home.
Oh, really?
Because it's, subtropics. There's going to be cockroaches everywhere.
Yeah.
I think the family saw 2 or 3 in the building.
Okay.
So it wasn't a bad deal. I mean, it's not like when I was at the Jacarde Suites in Las Piñas, Philippines 20 years ago.
That would make it.
That was unique. There was a cockroach there that was longer than my foot was wide, getting chewed on by a lizard in the hallway at night when I was checking in. That was cool. Welcome to Chat with the Docs. We are back, and if you're wondering, this is just what I got to get caught up on, my busy work that I got to get caught up on the calendar that Doc Noel got me for the holidays.
Yeah.
Thank you.
You're welcome.
And that said, it's the thought that counts. I couldn't find any ducks, and I couldn't find any mugs that were worth any. They had some.
It's not a cockroach, is it?
Fine. I even had it in a brown paper sack. No.
Thank you. May I open it?
Open it. Brought that all the way back from down south,
Oh.
I expect you to name him.
Dewey.
It's a rooster.
Dewey the Doodle.
Dewey. Truman defeated him. I'm sorry to have to bring it up again.
He's so cute. Thank you.
Glad you like him. This is our first time back.
Mm-hmm.
We haven't done this in weeks. We're a little rusty. We're hoping we don't get shut down. Just posting that we were back.
Sabbatical
on
is
Facebook,
apparently a bad word.
and we used the term sabbatical on our Facebook link. We were warned about this post has not been checked by independent fact checkers. Fact check that.
Fact check, you were gone.
Fact
So
check,
I would say yes.
Gone. I can prove it. I have the receipts. So before we left on last show, we had a couple of questions that we didn't get to. So
Okay.
we're going to get to those today.
Is that on page 2?
No, those are the first 3. That's
Those are the
Sonia,
first ones.
Grant, and Barry.
Okay.
Page 2
It's been
were a
so
couple
long
that came in.
that I can't remember.
And we will have your answer to the last conundrum that we did,
I don't even remember that.
as well as this week's conundrum. We've got a busy show.
It's going to be fresh, especially to me.
Yo. You say that, and I think of Will Smith in Bel Air, West Philadelphia. But, I watched Gemini Man,
Yeah.
and I couldn't take it seriously. I was expecting him to walk out with his hat like this and some pink outfit.
That was probably one of your favorite shows, too.
No, I couldn't stand
Probably
it.
related to it. Just kidding.
I did get beat up on the playground a lot.
No. Weren't you homeschooled for a bit?
Yeah. 3rd grade, 4th grade, 5th grade, and 6th grade.
So that was your brother?
No, that was when my brother wasn't around.
Oh, okay.
He would take care of things and keep me from getting beat up. And then when he wasn't around, I learned that what you do is you create a small business and you let the bully, you hire the biggest, baddest bully in school
Mm-hmm.
to go do collections for you. got me out of trouble.
That works.
I didn't get beat up after that. Got busted by the teacher and recommended for the RICO Act. But fortunately, they don't apply that to third graders, second graders.
Start them early. What do you want to do first, Mo?
I don't know. I thought we'd sit and have a cup of coffee and just kind of chew the fat.
Got to get reacquainted. It's been a bit.
It has. It has. How you've changed. Well, you had a birthday.
I did. Was it that long ago that we
You're
didn't
a
get
certified geezer now.
That's right. The big 3 decades.
Woo! You said it. I didn't. Everybody over the age of 40 says, huh? Geezer? Humor. Just humor. Sonia from Milwaukee, Wisconsin. Where do they come up with these stupid abbreviations? I was driving across Missouri and I thought it was the most friendliest place.
Yeah.
They'd have Moe's Best Barbecue, and I'd feel compelled to pull over. So Sonia writes,
Let's say what's abbreviated.
Go ahead.
Okay. She says, I was diagnosed with autoimmune colitis when I was in high school and have struggled with it ever since. I have been put on immune suppressant drugs and nothing really fixes the problem. I still have the colitis. I'm now 34 and would really like a better answer, especially when I start reading about long-term effects of the medicines. I'm depressed, so I have to take antidepressants, and I really need help.
Yes, Sonia, you do. You poor thing. That's a long time to be sick. Now, if you were sitting in this room, the first thing I would do is we would, obviously do a workup and take some pulses and figure out what your Chinese pattern is. Look for possibility of chronic infections. But we would also look at clearing your body of allergens, because and I know I can almost hear them telling you when you ask them, why am I not getting any better? It's, well, this is genetic. It's just something that you have to deal with. No. Something turned the gene on, and it doesn't have to stay there. You don't have to live with this your whole life. What a struggle. What a struggle.
She probably feels like she can't eat anything,
Well, yeah, you can't. Everything just tears you up. So what we would look for is we would clear you using the NAT of your different allergens. We would use acupuncture to clear the heat out, to get rid of that acute nature of the colitis, to try to turn the colitis off, get you out of whatever flare that you're in. So then you'd be, I think the official term would be remission, colitis remission.
Do you think they even went through the things that she's eating, or do you think they just put her on medication?
Probably put her on medication. I'm sure they went through and did an allergy test with a little scratch test on the back, but that's not going to identify sensitivities. That's only going to identify full-blown allergies. But you can have an allergic response to something without throwing the typical antibodies for an allergy. We call those a sensitivity. IgG, IgA, and a bunch of different IG responses. And no, I'm not talking about grocery stores. So Safeway, quit coughing at the mouth with excitement that someone else got free advertising. Are those guys even around anymore?
I know what you're talking about, but I don't know.
The last IGA store I ever saw was in Peoria, Illinois.
Maybe
so the question is,
cities.
Does IGA even play in Peoria anymore?
Next question.
Well, no, we're not done here. So we need to identify what
What's the cause of this?
sensitivities are, because there are foods that you are eating, and I can guarantee this, Sonia, that are feeding the colitis. First things that I would suggest cutting out are grains and gluten, eggs, and dairy. Those are the big three that you just cut out immediately. And you cut it out for a good 6 months, because you're still going to have the traces of these antibodies in your body for a good month.
Mm-hmm.
And then it takes time for that inflammation to drop. And then it takes some rebuild and repair time. It's not something that, oh, I quit eating today, I'm good to go. Our expectations of our bodies are unreal.
Mm-hmm.
I have people who will come in and say, well, I've given it 3 or 4 treatments, and you've dropped my pain, and the symptoms were under control, but I'm done with the acupuncture now. I've had a full treatment course. No, you haven't.
Mm-hmm.
We're still retraining your body. Supplements can take a month to 6 months to start working. Herbs can take a week to 3 weeks to start working. Well, is that so out of norm? No, because
how long did it take for this problem to even start?
Well, and pharmaceuticals. How long does it take for pharmaceuticals to kick in?
Mm-hmm.
When you started on your SSRI, your select serotonin reuptake inhibitor, your antidepressant, Sonia, they probably said, well, you probably will start feeling better in about 2 to 3 weeks.
It wasn't immediate.
It's not immediate.
Mm-hmm.
These things take time because your body is so intricately designed. It takes time for these things to gain traction and start the healing process, and then to get the healing process far enough along where you're noticing big differences. It can take a while.
Mm-hmm.
So you definitely need to see, at minimum, a naturopath. I would say at best, naturopath, acupuncturist. There's a gentleman in your area, Sonia, who is very good with acupuncture and all things structural. If you're in the Milwaukee area and you need somebody with fresh eyes on a problem, go see Dr. Luke Laga at Laga Wellness. One of the best structural guys out there in acupuncture. But acupuncture is more than just structural medicine. I'll have patients that'll come in for knee pain and they'll say, do you do anything for stomach pain? Yeah. Oh, I thought it was all just structural pain that you did. No. Acupuncture will do pain. It'll do structural stuff. It'll do internal medicine. We can do psychiatric stuff.
You're able to treat multiple things in a session.
We're able to treat multiple things in one session. And then when we pair it with somebody like you that works on the neurological system,
mm-hmm.
You're taking a neurovascular medicine and pairing it with a neurostructural medicine.
Mm-hmm.
Man, it's great stuff.
Well-rounded care.
Well-rounded care. By the way, when I was down south, I realized just how out of shape I was. Speaking of well-rounded.
That's okay, Mo. You're pretty thin usually.
Wow.
You get like the rest of us.
I was walking. I had to go 5 miles up the beach because the road was shut down, and I was walking lickety split up the beach, and I couldn't believe how out of shape I was and winded I was. It was ridiculous.
Well, you're usually working all the time, though. I mean, sometimes you don't get home until, 9? Some nights?
10,
yeah.
Sonia, the other thing is the depression aspect of it. You're depressed because you feel terrible. You're depressed because you've been struggling for so long and you're not getting any hope.
Mhm.
One of the beautiful things about the acupuncture and some Chinese herbs, the right Chinese herbs, they can affect the colitis, they can affect the depression.
Well, the brain gut connection too.
Yes. When that small bowel's not functioning, and if the large bowel's not functioning, the small bowel's definitely not functioning. When that's taking place, your brain's not going to be producing properly. Let's answer the last conundrum that we had.
Okay.
Do you remember the last conundrum? You
Barely.
don't, do you?
No.
Fortunately,
This is all new to me.
I keep it. I keep it on file in a hermeneutically in a sealed envelope on my whiteboard.
There you go.
And if you recall, Dr. I was going to read 2 weeks ago. A patient came into Dr. Gesundheit's office complaining of right abdominal pain. It's right along my ribs and it feels like I'm being stabbed. The patient said it always happens right after eating and when there was any kind of stress.
Okay.
Dr. Gesundheit palpated the patient's liver, felt no abnormal swellings, but the patient did say that it was tender. I actually had a very similar case call me up this morning on his way to the urgent care,
Okay.
where he's going to have to wait a couple hours to get treated.
Yeah.
Dr. Gesundheit's patient skin around the mouth was slightly yellow and the patient was anxious. Dr. Gesundheit took the patient's pulse and found the left sun to be deep and scraped, almost knotted with a distinct vibration in the pulse. What was Dr. Gesundheit's diagnosis? The key to this one, do you want to know the clue? The clue is treat the pulse.
And the pulse thing, that's your expertise. When I'm hearing that it's under the ribs on the right side, he palpated liver, it was good, but it was kind of tender. I'm thinking it's right around the gallbladder, especially after the eating.
Very good. The location is correct. And in fact, we had a fellow, Isaiah, wrote in back on the day of, it wrote back in on the day of that last conundrum, eager beaver. And Isaiah wrote that it was a gallbladder tumor. Good guess, your right location, but my friend, you are wrong.
Do you usually hear of any tumors in the gallbladder? I would say I can't think of at least a normal
sure it's
one.
Possible?
I'm sure it's possible.
When you feel a tumor or if there were stones, it would have a different pulse. Mm-hmm. When there are gallbladder stones, you would feel in that left sun, you would feel almost like the prick of a pin poking the underside of your finger.
Okay.
This had a distinct vibration to it, right? It was knotted and scraped. Scraped is the classic definition of scraped is you're taking a knife and you're rubbing it along the bamboo and it's going like that.
Okay.
So you've got that rough feeling in the pulse. The blood's not coming up smoothly. The blood's coming up. And there's a vibration. So it's almost like that blood vessel is vibrating as it's going through. So correct in location. However, within the Chinese pulse diagnostics, that pulse is indicative of something living in that bile duct.
Okay.
Again, if it were stones, you'd feel it as classic description would be a bird peck. Okay. A little bird pecking at your finger. Or a stirred bean, even. With this vibration and the scrape, everything's knotted up and tight, but there's something living and vibrating in there. So the answer to this last conundrum was parasites in the bile duct. Wah, 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 wah. And we don't have a winner.
Well, it's not a tumor.
It's not a tumor.
It's space occupying, but not a tumor.
It's space occupying, but not a tumor. And the distinction is the texture of that pulse. And I have felt pulses in people's tumors before.
People's tumors?
Hmm?
You said in people's tumors? Like
I have felt tumors in people's pulses
Okay.
before. That tumor sensation, and it's always that bird peck.
Okay.
Now, can a Chinese pulse diagnostician diagnose you with cancer? No, we cannot. The FDA would come unglued. We'd all lose our licenses, and Facebook would say, this has not been certified by an independent fact checker.
But you could tell though if something wasn't right and refer them
Mm-hmm.
to go to an
But what you
oncologist.
can do
or
is say,
PCP.
you know what? We have toxic heat and it's very focalized.
Mhm.
You need to get this checked out. And I have made that diagnosis.
It's more common than you think, unfortunately.
Yeah. And it's when you consider the pulses and you consider the different types of cancers, a leukemia pulse, a blood cancer pulse, is different than, say, an adenocarcinoma
That
type
makes sense.
pulse. Yeah. When you're dealing with a tumor, you feel the little bird peck. When you're dealing with more of a deeper blood issue, it's more of a knotted and deep, and there's just nothing flowing, which is really kind of cool.
And it makes sense because they get overproduction of those cells and then it really can't flow like normal.
Now, if I were doing my job, I would have told you already that if you'd like to be part of the show, you can call us at 608-314-8791, and Carrie will be there to answer your call and let me know on the
And
messenger.
that would be a first if somebody did.
Well, we had someone call before. They just decided to take the answer off air.
Oh, okay.
So, Grant in Spokane, Washington. I started a new job last month after being out of work since spring. Oh, poor guy. I have been really nervous and stress level has been super high. I have been having severe stomach aches since I got hired and vomit uncontrollably. My doctor put me on something called clonazepam, and I really don't want to be on it anymore because it isn't helping at all. Do you know of something I can take to help with this? I'm getting desperate. Yikes. Number
Vomiting
one.
uncontrollably.
What's your impression, your initial impression?
Something's going on with the nerves. Vomiting uncontrollably.
Anxiety, right?
Anxiety, and I would think others beyond that too. Maybe
Chinese,
the vagus nerve.
Aha. Yes. Now, when we talk about vagus nerve, you do not need to get dressed up like, Elvis Presley and wear your triple knit sequined leisure suit.
Vagus, not Vegas.
Please leave your triple knit sequined leisure suit at home. And how do you know it's you always? Why do people always think it's Nevada? There's a lovely little Las Vegas in New Mexico.
Is there really?
There is.
There you go.
There is. Been through there many a time. Chinese medicine. And I'm sorry to jump in on you, but this is exciting. This one's exciting. Chinese medicine gives a beautiful, very elegant explanation for this. The guy's been out of work, subsisting on stimulus checks and who knows how else, just trying to get by. Stress has been high, trying to go back to work, finally gets a job. Now he's worried about holding this job. Stress is high. He even says it's super high. He's had severe stomach aches since he got hired and vomiting uncontrollably. Western medicine would eventually work out to either a vagus nerve situation, anxiety, and or abdominal migraines. In Chinese medicine, we would look at this and say, oh, liver invading spleen and stomach. Your liver has, Western medicine acknowledges that your liver has its hands in over 500 functions of the body. Okay? In Chinese medicine, we say liver invading spleen and stomach. So it's liver function overacting, causing more bile to be produced and dumped into that small bowel,
irritating
it. And now what do you got to do? Now your body's going to try to purge it. And it usually comes up. And so I'm assuming, Grant, that you've probably been vomiting a lot of bile. You're not eating, it still happens, and you vomit the bile. I actually see this probably 4 or 5 times a year in people. And so what do? We give them a Zhui Yin, Xiao Yin balance treatment. We try to balance those two vessels. Zhui Yin is the liver vessel. Xiao Yin would be the kidney. Now in the arm, you still have a Zhui Yin and Xiao Yin. So you have kidney and liver in the leg. Zhui Yin in the arm is pericardium, and heart, Xiao Yin. So in Chinese medicine, what do we know about the heart? The heart is where the Shen resides, your spirit. Okay? So where we think and process the world, and where our anxiety, when that Shen gets agitated by heat, or maybe the liver is really constrained and lymphatics aren't draining, and everything's just kind of holding on to. And when that happens, we've talked about this ad nauseum, that creates liver inflammation, right? Mm-hmm. That heat gets transferred to the heart, and you end up with that Shen getting cooked. What happens if you are sitting in a hot car wearing a coat and you just ran a mile?
So probably.
You're going to be going, and you're going to be real anxious and antsy to get out of there, right?
Yeah.
So the heart does this, the Shen does the same thing. And so then you end up with this anxiety. So what we do is we treat that Zhui Yin, Xiao Yin relationship using the acupuncture, and we can usually get those things shut off within 1 or 2 treatments with the acupuncture needles. Then I utilize, there's classic formulas that you can use, Gui Pi Tang and Xiao San, but there's a beautiful formula from Evergreen Herbs called GI Harmony.
I like that one.
I love that one. I love that one. You give these people GI Harmony right out the door, and they start feeling better immediately. Mm-hmm. They just start feeling better. And you know, we've got someone else here where the answer was to put them on an SSRI drug, an antidepressant. It's not, you're hearing it from their words. It's not doing anything. Sonia said, I'm still depressed. Mm-hmm. Grant says, it isn't helping at all. So, Grant, get a hold of somebody there in Spokane or go over the hump to Coeur d'Alene. I know it's not that far. See somebody there. See if you can find a modern pulse acupuncture clinic, or a DNA, MPA or DNA acupuncture clinic. Either one, they're going to be tied in with Dr. Bob Doan from Puget Sound area, and they're going to be very, very good and very well astute on treating that Zhui Yin, Xiao Yin balance. Also, they're going to be very up on what would be the appropriate Chinese formula for you. But this would be a classic case where Western medicine is going to waste a good 6 months to a year of your life and not get you any better. Alternative, integrative is going to get you some relief immediately. I'm talking very first treatment.
Yeah, 6 months would be a long time to keep feeling that way.
Oh, yeah. You and Barry?
Sure. Barry from Nashville, Tennessee. I used to love to drink coffee, and I could drink a lot without feeling jittery. We moved to a new house, and since the move, I've noticed that coffee sits increasingly not well with me. I feel jittery, and I can even feel tired after drinking it. In general, I hate how I feel after drinking it. Now it's not a big deal to drink coffee, but but I'm worried it might be trying to tell me that there is something wrong.
Wow. Barry, not only are you well spoken, but you're very wise. When your body shows you that something that is normal to you is now having an adverse reaction, listen, pay attention.
Mm-hmm.
You moved into a new house. Look for mold.
Mm-hmm.
Look for mold, Barry. Look for mold around your bathroom. Look for mold around your kitchen. Look in the eaves of your house. Look for, there might have been, you guys get ice storms down there. Maybe you guys had an ice dam at one point and built back. That's what we all have here right now. Look for mold. Because what happens is when you get into the presence of mold and you're having a reaction to the mycotoxins that the mold gives off, you can often have an opposite reaction to the substance that you would normally have.
You've been saying that all along since we even started these shows.
Yes.
You say coffee can even contain mold.
Coffee is notorious for mold. Check it out. Take your coffee cup, leave some mold in there, and leave it out for 5 days. When you come back, I guarantee it'll be covered with mold.
Put some mold in there, or just put some grounds in there?
Just coffee like this.
Okay, you
Just
said put some mold in there.
Oh, I'm sorry. Put some coffee in your cup. Just leave a little bit of coffee in the bottom of your cup, and just set it there for 5 days. When you come back, it'll be covered with mold. Coffee beans are notoriously filthy for mold. They're notoriously filthy for pesticides. What is it, 250 pounds of pesticide used per acre on coffee, average? We were just having this conversation. I love coffee,
Mm-hmm.
and I drink certified organic, certified mold-free from a third party. You don't want somebody certifying themselves.
You know, something else too. You said it was 3 things.
Alkali. It's
Okay.
also an alkali coffee based on, so when you brew it, instead of being acidic, it's alkaline. You can test that easy enough just with
That's
some litmus
interesting because
paper.
most coffee is acidic.
Right. But depending on the soil and where it's grown.
That's what it takes up.
Yeah.
Okay.
So you may need to get your hands on some of this stuff. And I don't remember.
Did you get that down in Alabama? Or?
Foodforhealing.com or foodforhealth.com. You can get this type of coffee. It's very good. I enjoy it.
Cool.
But you are correct. Number 1, change the coffee you're drinking. Get stuff that's certified clean, mold-free, organic. Number 2, check your house for mold. And you're going to have to go through with a fine-tooth comb. And you might find it on some furniture. You might find it, how do you like that? A calculator just came up. You might find it in a number of places. But check with the obvious and then work out from there to the not so obvious places. Are you ready for this week's conundrum?
Yeah.
Are you?
Yeah.
Erlene Schmutzer. Now, I know you always make fun of my names, but there was actually a Dr. Schmutzer at Moody Bible Institute.
Really?
When I was there. I didn't have his class, but I didn't have any class then anyway. Erlene Schmutzer was driving her 1978 Olds Toronado.
I was wondering. I was trying to look over that, and I was like, it's not tornado.
From Toledo to Amarillo. Now, what do we know right now about Erlene Schmutzer? Have you seen a 1978 Olds Toronado?
It was from the 70s, so it was probably cool, but I can't picture it.
There's nothing cool about it. There's nothing. They were
So like a Gremlin or
Oldsmobile
what?
was trying to be luxuriant.
Okay.
So they made this big long nose, and yet they wanted to be sporty, so they put a tiny little rear end on it. Think of a Lincoln with trucker butt. that you have an Olds Toronado.
Look it up. Keep going. I'm gonna look it up. I gotta picture this out.
She had been staying away from the traveler's normal gas station diet. Good for you. And was eating a steady diet of baby carrots, celery, and ice cold water. Exciting stuff.
I'm hungry just thinking about that.
Not me.
For how hungry she would be.
When we go on long trips, we usually take a couple pounds of jerky with us. And then we're usually all so by the time we get there.
Yeah, I'll say.
Long about Joplin, Missouri, Earlene started to have sharp pain in her lower right abdomen. Ooh, never good.
Oh, okay, that's what it looks like.
The pain was coming in waves and felt severe. She pulled off in Tulsa, looking for an urgent care facility, but found instead Dr. Peabody's Acupuncture Emporium World. Wow. We need to change our name. Dr. Peabody brought Earlene into a treatment room and examined her pulses, palpated her abdomen, asked about her diet and bowel elimination, and then sparked up a few cones of mox and began to heat Earlene's lower right abdomen. What was Dr. Peabody's diagnosis? Now, typically when you've got somebody with pain in their lower right and you do the McBurney's sign?
Oh,
and you say, oh, it's
appendix.
positive. Normally you refer them out immediately.
Mm-hmm.
This guy felt clinically astute enough to do some treatment first to try to alleviate symptoms before he referred. That's very interesting. What was his diagnosis? If you think you know the answer, do not write it anywhere near a 1978 Olds Toronado. I can't think of anything from 1978. Well, the 1978 Triumph Spitfire was pretty cool. I had one of those.
Cool.
Caught fire. British Leland, what do you want? If you think you know the answer, write it on the inside band of a size 7 5/8 Stetson 5X beaver skin hat with a gust brim. Very specific, aren't we?
You don't want to get the answers, do you?
I'm just hoping we've got someone with a sense of humor and money. And send it to us. What's our address here?
839 Harding Street.
839 Harding Street. Janesville, Wisconsin, 53546.
45.
53545. I don't even know where I am today.
That's what I've always put. It gets here.
What are we doing here, man? There's Mo's getting existential. Can you tell I've had very little sleep?
I'm drinking coffee. That's a change.
Wow.
Coffee with caffeine in it.
So, if you think you know the answer, write it, send it to us, call us, get it to us somehow. Singing telegram would even be acceptable. If you are correct, and if we have more than one correct, then we will pick at random. But if you are correct, then send it in, and we will give you a $10 gift certificate to our apothecary.
Mm-hmm.
Terry in Wauwatosa. Shall we be hip? Do you want to be hip?
Tosa?
Terry in Tosa. Go ahead. I wonder if she answers the phone that way. This is Terry in Tosa. Go ahead.
My right shoulder hurts deep in the joint and clicks a lot in the front when I move it. My doctor wants me to see an orthopedic surgeon and begin physical therapy. The physical therapy I'm okay with, but I don't want to talk to a surgeon. I hurt the shoulder a few years back at work, lifting a box from over my head. I went through physical therapy at the time, but the pain never did go away and has come back and gotten worse. Now with the clicking, I'm getting worried that something is broken or torn. Well, it could be torn. It could be a muscle imbalance because you've compensated. There's a few possibilities, but I know in the past that I was talking to the surgeon isn't always the worst thing, because good ones won't want to operate right away. They'll try to have you do some kind of conservative care like physical therapy, acupuncture, chiropractic before they do that.
Keep in mind, any jerk in a white coat, myself included, until we start that medical procedure, whether it's acupuncture, whether it's laparoscopic surgery, whatever, until we start a procedure, all we are I lost the word. Who are the guys that have an opinion about everything that you pay to find out what their opinion is? Consultants.
Yeah.
That's all we are. Now, we're consultants in a service industry. So we're burger flippers that have an opinion. That's what medical people are.
Oh my gosh.
Okay? If that doesn't get us shut off, I don't know what will. No, but think about it. We're giving you our best guess of what's going on.
Mm-hmm.
Do you have to take that as solid gold?
No.
No. Go out and get a second opinion.
Mm-hmm.
Ignore it. Jump in with both feet. It's up to you. You are the one that makes the decision.
Mm-hmm.
So it's not a bad idea to see what the surgeon has to say. It'll allow you to either rule out a surgeon if they say, oh, we've got to go to surgery right away. If that's what they're saying.
I had one this last week for a patient that they have mild disc bulge in their neck, and that's going into where the foramen is, and that's moderate, that it's having a little bit of pressure on the nerve. So there's obviously some pain there. And they're like, oh, they did 2 sessions of physical therapy, mind you, and
they want a laminectomy.
Now they want to do surgery. It's just like, and it hasn't even been, it's maybe been 12 weeks.
And that's be
wrong.
The type of surgeon that you want to laugh and walk out and say, well, there's one I'm not going to talk to.
And I tell the patients straight out, it's like, you can always go for a second opinion. Don't ever feel like that you can't.
And a third and a fourth.
Mm-hmm. But unless you're in a position that you cannot, like, let's say it was with the neck, you're dropping things, you literally cannot feel, you're starting to have serious damage that they need to do something. But if you're not, it's your choice if you want to go down that route, if you can't handle the pain anymore.
Unless you are to a point where it's either life-threatening
mm-hmm.
or it's causing more damage in other parts of your body,
mm-hmm.
then you know what? Try other options.
Because you can always do surgery, but you can't undo it once you do a surgery.
Thank you.
Because once you cut something, it's not like putting a replacement part in a car. You're cutting through other structures as well. You're cutting through other arteries,
and
nerves.
You're creating scar tissue.
Yes.
And once you start creating scar tissue, that scar tissue is very hard to get rid of.
Mm-hmm.
It can be done, but it's very hard.
That's why we try our best to work through problems with somebody before it gets to the surgical end, because it can open up a different problem. Like maybe you'll have the pain gone that was running, down your leg for sciatic, but then maybe they cut it and now you got pain by your groin.
Mm-hmm.
And,
then after 6 months, the pain going down the leg is back.
And sometimes they're great. They take care of the problem. Every situation's different. But
depending on the surgeon, they can be anywhere from 60 to 90%.
Mm-hmm.
Problem is, you might be that 10% where it doesn't work.
Yep. So there's a time and a place for everything, but we do try to help you so that you don't have to go down that route. But if it's something that's necessary, it's there.
There's a time and place for surgery, but you do everything you can to keep from going there.
Mm-hmm.
So number one, that clicking could be from a number of things, as you say. It could be as simple as myofascial adhesions, the body laying collagen down on the myofascia tissue, and that catching on itself and then popping over the top of each other.
Mhm.
It could be as simple as that. It could be any number of things. What I would suggest is, well, you're in Tosa, you're in the Milwaukee area, Terry. Either get thee over here and see us and have Dr. Noel take a look at you, or if you don't want to travel that far, go see Luke at Lago Wellness.
Where's he at? Is he in Tosa?
He's in Waukesha, I think.
Oh, that's close then.
So it's right next to Tosa.
Yeah.
See, you noticed I'm trying to be hip and say Tosa. See, even that got excited.
Yeah. He was happy. Happy days.
The neat thing about what Luke's going to do is Luke does something called structural elements. So he will look at that collagen adhesion and the pattern at which it's laid down. Come up with a Chinese diagnosis based on that pattern, needle for it, and then do some body work to start getting those adhesions to disappear.
That's awesome.
It's really phenomenal. And I know for a fact that he's actually sat in on a number of spinal surgeries just to observe. He used to do that regularly.
Yeah, there's Orthopedic Associates that's up that way, by like Brookfield area. So that's all close in there.
So you've got some options for you, Terry. Don't get surgery yet. Get some
and a good
second or
surgeon
third
would recommend
opinions.
it. Yeah. Orthopedic Associates are pretty good though, from my experience when I used to work up that way.
So give either Orthopedic Associates a call or Lago Wellness. Notice we're trying to have some answers for you if you've got questions and you're not around here.
Yep.
I think that's big of us.
Yeah. More than they get from some people, so.
Yeah. You may already be a winner. Are you old enough to remember those envelopes?
Oh, with that they come to the
With
door.
Ed McMahon, the Publishers Clearinghouse?
Yeah, that's don't they still do those?
I don't know.
I thought they did.
I don't know. My mom always did those. My dad always went like this. Alan in Youngstown, Ohio. What's in Youngstown, Ohio? Isn't there something important in Youngstown, Ohio?
It's Ohio. There's nothing important there.
Thank you. My big toenail has a black mark under it, like it would if I dropped something on it. Problem is, I never did drop anything on it. Is this a fungus thing?
Yeah, I would get that checked out.
Yeah.
Because I don't know how often he's exposed to the sun, but that could be melanoma.
Yes. Thank you.
And that's without seeing it, of course, but you know.
Alan, when you have a black spot under your toenail like that,
Or a nail.
or a fingernail, number one, the markings on our fingernails have a meaning. They all tell a story. It's not 100%, but it's a percentage game. And so if you've got a black mark on your toe, and it's not because your shoes are indenting and constantly bruising that up, it's not because you
drop something,
got angry at your 1978 Olds Toronado and kicked the front fender. Someone should put gull wings on one of those things if they're even around.
Flyway.
It's because in many cases, a high percentage of the situations, it's because your body has a melanoma infection. So go get it checked out immediately. Sooner the better. Melanoma is a very fast-moving cancer. You don't want to fool around.
And that's like any spot on the skin. If it's really, really dark, those are the sun spots that you are a little bit more concerned with.
Yeah. And if it's growing, if it's got irregular borders, if it's raised up.
Looks different than it used to. It's starting to change pattern.
Yeah. If it used to look like Cary Grant, it's now looking like, I don't know, Ross Perot. You got a problem.
See, I notice when I get my sunspots, it's always this time of year. It's in the winter that I notice I get new sunspots.
See, I'm in grand solar minimum, so I'm not getting any sunspots.
That's always been though.
That's interesting. It's interesting as the pigment comes to a minimum.
That's when I'll notice new ones. Yeah, not in the summer. If you get burned really bad, obviously you're gonna have markings, but yeah.
Well, it's happened again.
You've wasted a perfectly good hour
with us, of all people,
at the Salem Center.
I thank you, and it was free.
Mm-hmm.
You got an hour one-on-one with the docs and the chicken. I'd say that was great time spent.
Mm-hmm.
I had fun. It was
Me
good
too.
to be back. We'll be back next week with more of your questions. If you have any questions, feel free to email us, info@siloamcenter.com, or do it in the comment section, or call it in, 608-314-8791. Get a hold of us. And if YouTube cuts us off, well, we'll find something else. So until next week, be well, shalom, and with all that's going on, take time to be intentional to give yourself a laugh somewhere.
Mm-hmm.
As high pressure as everything is, goodness sakes, take some time to laugh, take some time to take a breath. Everything that's going on is very important.
But we don't have control over everything.
But we don't have control over diddly squat.
Except your health.
So try to get a good laugh in. Be intentional with your family. Take a breath. So till next week.
Bye, guys.
Adios.